Hello nurses all over the world. My name is Nurse Felicia and I want to welcome you back to my YouTube channel. You're very welcome. I like your comments so far, your likes, your subscription, and I want to urge you to keep it rolling. Make your comments. I want your suggestion and your opinion on how I can serve you better. Okay, so today we'll be talking about hypothyroidism. Yeah, so we'll start from the definition of hypothyroidism. And hypothyroidism is caused when the thyroid gland is not producing enough thyroid hormone. And the thyroid gland, I said last week, that is located at the anterior part of the neck. So the thyroid gland is a small butterfly-shaped organ that is sitting in front of the windpipe. And the function is just to produce hormone that helps the body to regulate and use the energy that is required of it. So when the thyroid gland is under effective or not producing enough thyroid hormone, then hypothyroidism sets in. Let's talk about the risk factors of hypothyroidism. The first one is being female. So female are at higher risk of hypothyroidism compared to the male gender. And another one is being at least 60 years old. So old age also predisposed individual to hypothyroidism. The third one is being treated with radiation therapy of the neck or the chest. So people that went for radiation of the neck or the chest are also at risk of developing hypothyroidism. Recently being pregnant, so pregnant women are also at risk. Having a family history of thyroid disorders, that's another point under the risk factors of hypothyroidism. The last one is having certain autoimmune disease like Graves' disease, type 1 diabetes. So this can also predispose individual or make the individual to be at risk of having hypothyroidism. So the next thing I'll be talking about is the causes of hypothyroidism. It's divided into two: the most common causes of hypothyroidism and the less common causes. So the first one under that one is Hashimoto's thyroiditis. The second one is radioactive iodine treatment. So people that undergo this treatment can come down with hypothyroidism. The third one is thyroid surgery. The fourth one is radioactive therapy. The fifth one is medication. And the sixth one is iodine deficiency. So people with iodine deficiency can also have hypothyroidism. The less common causes, they include pituitary disorders, congenital diseases, pregnancy. So pregnant women also at risk, when I said it earlier in the risk factors. So pregnancy can also cause, but they are less common. So let's talk about the signs and symptoms of hypothyroidism. In general, the most common signs and symptoms of hypothyroidism, they include fatigue, weight gain, depression, constipation, feeling cold. So when patients with this kind of symptoms, they are cold intolerant. You see them always feeling cold. Even when there's no cold, you see their extremities are cold, they are feeling cold, they are complaining of cold. Another one is decreased sweating. In hyperthyroidism, don't forget, I mentioned profuse sweating. So in hypothyroidism, it is decreased sweating, slow heart rate, elevated blood cholesterol, dry skin, dry thinning hair. Talked about it, subtle hair in hyperthyroidism. So the hair is dry, thinning hair, impaired memory, muscle weaknesses, muscle stiffness, ache, and tenderness. Another one is pain and stiffness in the joints, fertility difficulties. Yes, this can also cause infertility. Menstrual changes, particularly irregular or heavy period. So in hypothyroidism, this can actually be signs and symptoms. Problem during pregnancy, which can be anemia. The pregnant woman can be suffering from anemia. And the last one is sleeping more than usual. Is one of the signs and symptoms of hypothyroidism. Another one is difficulty with feeding, and the last one is delayed growth. So if the condition is untreated, then it can lead to delayed growth. So severe hypothyroidism symptoms, let's talk about the severe symptoms, is puffy and sensitive face, hoarseness, anemia, and loss of hearing. So there can be involvement of the ear when it comes to the severe symptoms of hypothyroidism. In severe cases, severe hypothyroidism may result in mesodermal coma and is a life-threatening condition that requires emergency care. So it's just like we're comparing it to thyroid storm. So it's require emergency care. And the signs and symptoms of this mesodermal coma is fatigue, hypothermia, low blood pressure, low heart rate. So you see that it's something that requires emergency care. So a patient that comes down with mesodermal coma require urgent care. Let's talk about the diagnosis of hypothyroidism. The first one is medical history. So the diagnosis of hypothyroidism typically involves the combination of medical history, physical examination, and laboratory tests. I come again. It requires medical history, physical examination, and laboratory tests. So let's take it one after the other. So the medical history, you want to check for the symptoms, you want to check for the family history, if they have thyroid disorders in that family. Has anybody come down with thyroid issues like hyperthyroidism, thyroid storm, mesodermal, talk about thyroid disorder. So we want to check. And medication use, we say that certain medication can predispose an individual, can make them to be at risk, and can also even be a cause of hypothyroidism. So you want to check some medications that they are on that is actually interfering with thyroid hormone production. Another one, when it comes to the physical examination, you check their vital signs, you check their appearance. We're talking about puffy eyes, sensitive face, we talk about depression. You just check them psychologically and physically. So you check their appearance. And the last one is laboratory test. So you want to do a thyroid function test. This is the major part of this diagnosis. So the most common tests are thyroid stimulating hormone. That's you want to check the level of TSH, which is thyroid stimulating hormone, in the blood. If it is low, then there is hypothyroidism. And sometimes you can check for T3 and T4. Those are the hormones that the thyroid stimulating hormone produces. So, and T3 is triiodothyronine, and T4 is thyroxine. These are the hormones that is being produced by TSH. Low level of T3 and T4 can be indicative of hypothyroidism. Other tests that can be done in some cases, which can be additional tests that may be necessary, thyroid antibodies, just to determine the cause of the hypothyroidism. So let's talk about treatments. The treatment of hypothyroidism is thyroid hormone replacement therapy. That's the major treatment of hypothyroidism. And it typically involves taking a synthetic thyroid hormone medication, which is known as levothyroxine. That's a common medication that is being used by patients with hypothyroidism. So the goal of this treatment is to replace the thyroid hormone that the body is not producing on its own. This medication is taken by mouth, and it returns hormone level to a healthy range, eliminating symptoms of hypothyroidism. So that is the major work of levothyroxine. And patients start to feel better within 1 or 2 weeks after they have started the medication. And this treatment might be a lifelong treatment because the dosage that is being needed by the patient may change. The doctor may have to be checking the thyroid stimulating hormone every year to check for the level of the thyroid production by this particular hormones. Let's talk about the factors affecting the treatment. Factors that can affect the treatment of hypothyroidism. The first one is severity of hypothyroidism. So the dosage of levothyroxine will depend on the severity of the condition. Another one is age. The dosage may need to be adjusted for infants, children, and older adults. Another one is other medical condition. So existing health condition can influence the thyroid hormone dosage. The last one under the factors that can affect the treatment is medication interaction. Certain medication can interfere with the absorption of effectiveness of levothyroxine. Having known these factors that can affect the treatment, then it gives you an insight into checking the medication of that patient. When you check it, then you check for drug-drug reaction. Okay, so let's talk about the complication of hypothyroidism. The first one is heart problem. The patient begins to develop heart issues like low heart rates, palpitations and all like that. The second one is goiter, and another one is nerve injury. So the nerves begins to get damaged or injured. Another one is peripheral neuropathy, and another one is carpal tunnel syndrome. I'm looking forward to a day and we'll talk about this particular condition. So there's also reduced kidney function. There's myxedema coma in severe cases. There's obstructive sleep apnea, and there's mental health issues like anxiety and depression. There's joint pain, there's balance issues, there's obesity, even though there's still research on this particular complication, if it's actually true or not. And there's high cholesterol, there's infertility, there can be preeclampsia and anemia during pregnancy. And another complication is birth defects. We talked about congenital disease earlier. So let's talk about the key nursing responsibility in the care of patients with hypothyroidism. The first one is assessments. So under assessments, you have your comprehensive history. So you gather detailed information about the symptoms, about almost everything about the patient, so that this will serve as a baseline data for you in this care of the patient. And another one is physical examination. You do your head-to-toe assessment. You check even from their ear. You check it because one of the signs and symptoms of this hypothyroidism is dry, thinning hair. So you check for brittle hair, you check for weight gain, you check for brittle nails, you check for slow heart rate, then you do your vital signs, in your physical examination. And another one is laboratory tests. You coordinate thyroid function tests. I know you're not the one that will do this particular test, but you ensure that your patients do this test as prescribed by their physician. Let's talk about the medication management under this responsibility of ours. First one is education. You educate your patient on the disease process, dosage of the hormone replacement therapy. You explain the possible side effects of the particular drug they are on. And you do your monitoring. Ensure adherence to medication regimen and monitor for adverse effects. Another one is adjustments. So you collaborate with the healthcare provider to adjust the medication dosage as needed. That's why you have to keep tab on their laboratory investigation. And the last one is patient education. You educate the patient on the disease process, explain the causes, the symptoms, and the treatment option for hypothyroidism. You educate them on lifestyle modification, ensure that you provide guidance on diet, exercise, and stress management. Then medication interaction. You can educate the patient about potential interaction between thyroid medication and other drugs. So you want to check for patients that have comorbidity. Patients can be having type 2 diabetes, they're having hypothyroidism, they're having high blood pressure. So you educate them on possible drug interaction. Then symptoms management. Patients that are coming down with constipation, you recommend dietary changes, high fiber diets that can help them, high fluid intake, and over-the-counter laxative as needed. So you educate your patient on that. And patient that comes down with weight gain, then you discuss healthy eating habits and exercise to manage their weight. Patient that complains to you of fatigue, you educate them on adequate sleep and stress reduction techniques. And also teach them when they are stressed, deep breathing exercise can also be used. And another one is monitoring for complication. This is very, very important. So myxedema coma, you want to watch out for this particular complication. Be vigilant for signs of severe hypothyroidism, which is myxedema coma, including altered mental status, hypothermia, and respiratory depression. So you want to watch out for this. Cardiovascular risk is still under the monitoring for complication. So you monitor for heart rate changes, blood pressure fluctuation, and the development of heart failures. And the last one is follow-up care. Yes, you can't do away with this as a practicing nurse or a student nurse. So you do your regular checkups, schedule periodic appointment for thyroid function tests, and you assess the patient's response to treatments. This is important. Then you make your referral. So you refer patients to a cardiologist, endocrinologist, or other specialists as needed. So by providing comprehensive care, nurses can significantly improve the quality of life for individuals with hypothyroidism, and you can help them manage their condition effectively. This is very, very important. And in doing this, your care will go a long way in ensuring the recovery of this particular condition. I hope you have been able to learn one or two things in this topic. I want to appreciate you once again for always coming back to my content. You are so amazing, and I honor you all for always coming. Don't forget to comment, hit the like button, and subscribe to my channel. Make your suggestion about how I can serve you better and how to improve this channel. Thank you so much. My name remains Nurse Felicia, and until the next time, bye.